Okay, thanks for tuning in. I will be breaking down and comparing two ACL rehabilitation protocols and giving my opinion on each of their recommendations. So the two protocols I've chosen are from Brigham and Women's Hospital and Northwestern Medical Center. The strengths of the Brigham's and Women's I found to be that it's a generally comprehensive protocol with 4 stages, and it lists each phase of rehab and offers more in-depth goals for each phase. The strengths of the Northwestern protocol are in their expanded suggestions for specific therapeutic exercises and a clear return to sport criteria. I also listed weight-bearing restrictions as a strength for both protocols because I believe this will be a strength or a weakness depending on the patient and their presentation and personality. I'll talk more about that in a minute. As far as weaknesses for the Brigham and Women's protocol, I really only outlined the limited weight-bearing precautions for the first 2 to 4 weeks. The Northwestern protocol suggests a less limited weight-bearing approach that's patient-dependent. They also set up a time frame for the patient to use a brace and stop that brace usage, which overlaps where the other protocol gets rid of the use of braces. But again, I feel like this may be a detrimental aspect of the protocol, just depending on the patient that you're dealing with and whether they're ready to be out of the bracer yet or not. So it may not be at the 6 weeks marks, but it might be at that point as well. Thinking critically about these protocols, I would lean more toward the conservative and therapist-driven approach from the Brigham and Women's protocol, since I think that the Northwestern one generally follows the same timeframes and the line of thought as the other protocol, but their timeframes and earlier weight bearing may be detrimental to a patient who's really aggressive in their approach to rehab, and they could be doing too much too soon in terms of letting the graft heal if that's their personality type. For my assigned patient, I can utilize these protocols by reassuring the patient that we're addressing her concerns for re-injury by following the Brigham Women's protocol, but also orienting her toward the progress that she's making and toward her next phase of the protocol so that she can work towards that. I can also use the variety that the therapeutic exercise sections of the Northwestern protocol has to keep her from getting bored and make sure that she's excited to try all the new exercises that are safe for her in that stage and are still challenging for her. Here are my references to each of those protocols I used. Thanks for tuning in.